don't really know. I'm an ND3. Like Christina said, I spent 6 weeks at True North Health Center in Santa Rosa, California. It's an inpatient facility that supervises water fasting, therapeutic water fasting for extended periods. So people can go there just for like a reboot and do a 5 or 10 day water fast. Or I saw someone go 28 days on nothing but water. So it was really inspiring and really amazing, and I wanted to share it with you guys. So I'm really happy to be here. I'm happy you guys showed up. All right, so I thought we'd start with just talking about the proposed mechanisms of fasting and why it's therapeutic. So 8 to 12 hours after you eat, then your food is fully assimilated and you're starting to use glycogen in your liver. So glycogen is primarily stored in your liver and in your muscles. So you'll run through your liver glycogen first. And then after about 12 to 24 hours, you'll deplete your hepatic glycogen, and that's when you start moving into your ketone bodies, free fatty acids, and then non-hepatic glycogen, so in your muscles. So fasting, what it does is it triggers an adaptive cellular response, which results in an enhanced ability to cope with a more severe stressful environment. So this is therapeutic because essentially it's going to, only the most fittest cells are going to survive in this environment. So this is great for many chronic diseases we'll get into, and really great for cancer. They're doing a lot of cancer research, and people that fast for 48 hours before chemotherapy and 24 hours after chemotherapy, the chemo is greatly, the effects of it is increased dramatically, and the side effects of the chemo virtually non-existent. So I like to think of it as our cells are protected in these states because of evolutionary processes, whereas these cancer cells, they have multiple genetic mutations and they're therefore more susceptible. So it also will decrease pro-inflammatory cytokines, TNF-alpha, interleukin-1, interleukin-6, increases antioxidant activity, increases neurotropic factors, BDNF, FGF2, increases neurogenesis. So it's really great for neurodegeneration in the brain. There's been a lot of research with it, with Parkinson's and Alzheimer's. Increases insulin sensitivity, reduces resting blood pressure and heart rate, increases heart rate variability, and they're saying this is likely due to increase in parasympathetic tone, increases autophagy, so like I was saying, only the most fittest cells survive. Sounds like we're going to take off in a spaceship. And so yeah, then the weaker cells are going to die off, and often those are diseased cells or cells that are have many mutations. So like I said, fasting has positive effects in cancer prevention and treatment. This is documented. So let's see, 20 to 60% cancer-free survival when compared to chemotherapy or fasting alone. So this was all done in mice studies. They have done some clinical trials in humans, but I don't have that data on that right now. They found in mice alternate day fasting caused a major reduction in the incidence of lipomas. Not lipomas, lymphomas. And fasting for 1 day a week delayed spontaneous tumor genesis in p53 deficient mice. So mice that their cellular detoxification pathways are altered or ineffective. It's protective against tumor genesis. So then the fasting for 2 to 3 days was shown to protect mice from a variety of chemotherapy drugs. And so it's called differential stress sensitization and differential stress resistance. So these are the mechanisms that the cell undergoes, like the normal cells undergo versus the cancer cells in a fasting state. So there's lots of research out there. If you guys want to look that up, you'll have access to these slides. Okay, so we'll move on. intermittent fasting, and then so just a small comparison of intermittent versus prolonged or extended. Intermittent, there's many ways to do it. You can do it like timed interval eating, where you fast for 16 hours a day and then eat for 8 hours a day. I think that's most widely used. You can fast every other day or 2 consecutive days in a week. Anything over 3 days is considered a prolonged fast or an extended fast. So both of them have benefits. I would say that extended fasting mostly has just the benefits you'll see from the intermittent fasting, but to a more extreme degree. So it increases adiponectin, which is a specific protein that the adipocytes use in regulating glucose levels, as well as fatty acid utilization. So this is like the cell's way to know when to store glucose and fat versus when to burn it, burn fat for fuel. So poor adiponectin levels, this will result in not successfully utilizing fuel you already have stored in your body. So this is found in people with diabetes or like insulin sensitivity. So essentially this is like the hangriness comes from you have to eat or you're not happy because your body doesn't know how to pull from what you already have, so you have to just keep eating to feel satiated. So the hunger response also has been shown to improve immune function, especially during aging. So just feeling hungry is a good thing. We all kind of attribute like the hunger feeling to, I don't know, maybe death from like evolutionary terms. Like when you were hungry, it wasn't a good thing, but now we just don't like to be hungry at all because I think it's evolutionary. Let's see. And then it also increases ghrelin, so that's that satiety thing. Ghrelin deficient mice exhibited accelerated thymic involution during aging. And then mice that were treated with ghrelin had increase in peripheral T cells. So their immune system was cranked up. So when mice were maintained on a prolonged fast for 3 days a week for 10 weeks, they were less prone to a hypoglycemic state during 2 hours of strenuous swimming exercises. And this, they said, was a result of the increased glycogen and triglyceride storage in the muscles, and then also upregulation of the tyrosine kinases, which leads to an increased physical performance. So it's that ability to pull fuel from your muscles or your adipose tissue when you need to really quickly. And then they found that in humans, just 5 days of fasting causes an over 50% decrease in IGF-1, insulin-like growth factor 1. And this was a 5-fold increase in one of the principal IGF-1 inhibiting proteins. So they're postulating that it was due to a protein restriction because you're not eating anything. But this is the major growth factor that is associated with aging and cancer. Okay, so I just want to throw in some stuff about disease. So dis-ease is a lack of ease or harmony within the body. And this can be due to a state of excess or deficiency. In developed countries, most diseases is a result of excess. Excess salt, sugar, fat, alcohol, animal products, stress, drugs, lots of other substances. Common diseases of excess that we see is type 2 diabetes, heart disease, vascular disease, Alzheimer's, epilepsy, Huntington's, Parkinson, and Parkinsonian-like diseases, hypertension, fatty liver disease, Crohn's, ulcerative colitis, interstitial cystitis, PCOS, all of these, anything that's going to cause any disease state that is a result of inflammation is disease of excess. And all of these diseases, they're seeing really great results from at True North. So pretty amazing. And then, so how do we protect ourselves against disease? Good nutrition. You know, we have whatever we feed our body, like that's what our body has to live off of and make new cells and support the cells it has. So if it's not getting the right nutrients, then it's not going to function properly. Also the emunctories, so the skin, liver, lung, lymph, kidneys, colon, mental, emotional, spiritual emunctory as well. So there's lots of things that we can do when we're taught, like skin brushing or sweating and cleansing or cleanses and flushes and hydration and qigong and meditation. And this is really great for patients to implement, but it takes a lot of compliance and it takes a long time for them to see results. So I think a much quicker way, and I saw this, much quicker way to jumpstart the results is with a water fast. That's why I'm here talking about this. However, the most important part of a water fast is the refeeding. It doesn't matter what you do for 10 days, it matters what you do for the rest of your life. So there's also lots of research that shows that a lot of cells are dying off during a fast for good reasons, but then once you start eating again, your cells start proliferating more so than in a normal state. So it's really important to, when you are refeeding, to feed your cells good, nutritious, wholesome food and not break your fast with a Big Mac. So yeah, the body needs to regenerate and rebuild. Just did all this cleansing, now we need to build it up properly. So, and then also, they really stress that True North is fasting is not a weight loss technique. It's good to do short fasts every month or every 4 times a year or something like that, but it's not for weight loss. But it will jumpstart a weight loss program. There were people that came in that one guy lost 40 pounds in 10 days, which is extreme, but that was a lot of water weight is what we were thinking. It's tremendous amounts of salt. But then they're going to gain that back because all of their glycogen in every muscle in their body has been depleted. And the minute that you eat food again, it's going to replenish those glycogen stores. So a lot of women were very concerned about the whole weight loss. I saw a lot of women there for weight loss. And it's something that they try and screen out before because it's not a tool that we should be using for weight loss. Starvation is not what we should be doing. And they also were really concerned during the refeeding when they would start putting weight back on. So we had to make sure to express that this is just normal physiological bodily functions. So this is the food that the diet that they promote at True North is whole food, plant-based, salt, oil, sugar-free. So everything that they cook is cooked in broth without any added salt, any added sugar, no oils, plenty of avocados and nuts and all that stuff to get those good healthy fats, but no pressed oil. Their philosophy is if nature didn't provide it, then we shouldn't be eating it. So if it grows in the whole form, then that's fine. They also don't do a lot of refined carbohydrates either. They'll make pastas and stuff every now and again, but no gluten ever. But so yeah, plant-based, whole food, SOS free. And this is something that they're working on right now, is trying to get a lot more follow-up research, because that's kind of something that's been lacking, and I think that it's something that's very important, especially to us as future physicians, to know that there's evidence supporting what we're trying to tell our patients to do. So they don't have a lot of evidence in how this diet works long run, except for the people that they personally communicate with. They don't have a lot of literature. So, but they're working on that. Okay, so epidemiology of chronic disease. So my thought is fasting, these long extended fastings are pretty amazing at treating chronic disease. And there isn't a lot of treatments right now for chronic diseases. Most of it's palliative at best. So finding something that's really effective, cheap, and yeah, I think it was amazing for me to find it. I'm glad you guys are all here learning about it. It's a great tool. But so chronic disease, according to the CDC, is the leading cause of death and debility within the United States, and it's expected to keep increasing. In 2012, 1 of every 2 Americans had at least one diagnosed chronic health condition, which I thought was pretty incredible. 86% of the nation's 2.7 trillion annual healthcare expenditures are for people with chronic health conditions. So that's about 2.34 trillion a year spent on diabetes and heart disease and these cancers that we know are like 99% preventable, so, with proper nutrition and exercise and all that. And so yeah, here's these like the major chronic diseases that we're facing now in the US and the rest of the world, developed countries. So I just threw this picture in here, and like, why is this chronic disease picture happening right now? It's because it's the food, and down here it says it's been the food all along. And this is Dr. Clapper. He was a physician at True North. He just retired, sadly. Was an amazing medical doctor, been practicing for 42 years. And anyways, he grew up on a dairy farm when he was young and helped his uncles do all that kind of stuff. And now he's been a vegan for 32 years. Our whole food plant-based. Okay, so what is Nature Cure? Nature Cure is establishing the foundation for optimal health by identifying and removing the causes to disease, allowing the beast to heal itself. And often these days, the offending agents is our food. So here's some nature doctors that we've all learned about in naturopathic history and philosophy. O.G. Carroll. I actually don't think we learned about Linda Hazard. She was a female. She was actually an osteopath and then claimed to be a naturopathic doctor because she loved the profession. Lindlar, Benedict, and Louisa Luss, and then there were many more people, women, people of color, who we don't really know much about because they're not in our history books. But they all used fasting for treatment, for chronic disease, for acute illness, and I just put this up here to remember where we came from and where our roots are, and be confident that this is what makes us different from other medical professions, is the ability to listen to the patient's body and know what that patient needs specifically. So the facility, 63-bed facility located in Santa Rosa, California. There were 60 plus patients at all times. Husbands, wives, partners, children, families, dogs. They're very friendly to dogs, which I like. It was founded over 33 years ago and they've seen over 16,000 patients thus far. And out of their 16,000 patients, they've only had 8 adverse events. So that's pretty amazing. Now, a few of those was like a mild heart attack, stroke. I personally saw stomach perforation and refeeding syndrome, which is when you eat way too much carbohydrates right after you're not fasting, or right after fasting for a prolonged time, and it actually is fatal. But none of these people had died from it. They just had to go to the ER. Usually fully booked. Waitlist is about 2 months to get in, especially since What the Health came out, because they were featured in that documentary. So they're staffed with NDs, LACs, MDs, DCs, psychs, chefs, nutritionists, housekeepers, grounds, receptionists, phlebotomists, billers. There's lots of people. They have 52 staff members. So a typical day as an intern, just in case any of you guys are wanting to go. We start at about 6:30 or 7 a.m. and usually we're not done until 7 p.m. and sometimes even later. It's a really long day, but it's great. And it took me about 2 weeks to kind of get accustomed to like working that much and after traveling and doing all that. But the best time that I had was talking with the patients themselves and just hearing their stories and what they've gone through and how they've exhausted all medical interventions, and then now they're here and they've been fasting for 6 days and they haven't felt as good in 30 years. And I heard that over and over and over again. It was pretty powerful. This is another intern here, Isaiah. He goes to Bastyr, San Diego, myself, and then this guy was fasting. He had gastritis for 30 years. And it took him 22 days of water fasting before the pain finally went away. He had just felt like GERD, but finally gave it away after 22 days. They weren't going to stop him until he did it. He was doing great. And that's his son. And they're from Turkey. So I got to meet a lot of amazing people. Turkey, India, France, of their patients come from out of the California state, and of that, like 25% come from out of the country. So and they don't advertise at all. They just have a website, and everything's by word of mouth, but it's just amazing. So patient experiences while fasting. 3 days prior to a prolonged fast, the patient is instructed to eat only whole food, plant-based foods. They're seen in the morning by the doctor and the interns. It's around 7 o'clock. There's lectures at 10, 2, and 6:30, and then we see them again at 3 p.m. So each patient is checked in on twice a day. At these times, we're assessing their vital signs, their pulse, making sure that nothing feels like alarming in their pulse. If anything happens, there's a 24-hour phone line that they can call, and it rings the interns. So we're also on call overnight. So they're advised to drink 6 to 8 glasses of water daily. They're advised to walk around the courtyard and do some gentle stretching. They may not leave the facility. There's too much liability with them not having any food in their system. So common symptoms of a detoxification is what we know is like the healing crisis. So it can be anything depending on the patient's story. It could be headaches and nausea and fever and malaise. It could be like a violent flu reaction or a violent cold reaction. It could have like pruritus or break out in like lesions, or it just depends on what that person has been through. So they're often concerned about this, and we just kind of have to like keep reiterating the healing crisis and what that means, and that's a good thing. Let's see. Usually they're hungry for about 1 to 3 days, depending on the person, and then they're kind of moving slow and kind of tired during that time too. But then often by day 4, they're feeling better than they've felt in years. Have a ton of energy, no more headache, no more feelings of being ill. So just things that we had to be on watch for was like if there's arrhythmias were often present in people's pulses, but anything over like 6 a minute was concerning. We'd run an EKG at that point. If they have any like chest pain that's been radiating to their jaw or shoulder, obviously we're thinking of like heart attack, stroke. You've got to be. So it's kind of stressful, especially if you've never like been in emergency medicine like myself. But it was a great experience, especially going in the field that we are. So I just included this, like ways to incorporate fasting into your medical practice. Obviously, inpatient is ideal, but that's not always going to be the case for us. So I just met someone when I was there over Christmas that did an outpatient prolonged fasting kind of scenario, and they'd have an intake with the patient, come up with their plan, assess the risk factors, of course, and then they would do Skype, and they would daily check in on them daily via Skype. They would give them like a blood pressure cuff and a temperature probe and all these things to be able to take their own vital signs and report them back. And then they would check in on them every few days and actually do home visits. So I thought that was really awesome, something I might employ. And then that's when you can draw bloods and collect UA and stuff like that. That's also something we did at True North. We drew bloods once every 7 days and collected urine analysis every 7 days as well, just to make sure that their kidney function is okay and their liver function. And that's kind of that's when you stop the fast, is when those things start decreasing. And then outpatient, like we can all recommend to our patients to do intermittent fasting. There's so many different ways to do it. The time restricted, the 5-2 method where you fast for 2 days a week, the warrior diet, or alternate day fasting. My mother-in-law just recently started fasting. She's almost 60 and she's fasted 3 days with nothing but water 4 times in the last 4 months, and she loves it. And like, if she can do it, I can do it, and we all can do it. So, and our patients can. So furthering your education at True North, if you want to go as an intern, I'm happy to give you all of the information and talk more about this one-on-one. There's also residencies. They're a year-long. You live on site, so they provide housing and meals. You're on call most nights as a resident physician. Many, many hours of patient interaction, and it's a great experience. And There's lots of literature supporting the use of fasting. This Walter Longo, he's at University of Southern California and the Longevity and Aging Institute, and he's got a lot. This paper is where I pulled most of my stuff from. And I've got one little video to show you that I thought was pretty good.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide. The average Canadian will spend their last 10 years in sickness. Change your future at makehealthlast.ca.
Okay, I don't have much time for questions, but I can take a few. Do you guys have any questions for me? Yeah, Alex? Other questions?
Yeah.
I don't know how much you have to do into this, but if you're like doing intermittent fasting, like 12 to 16 hours, what is the effect on tea and or coffee if you continue to drink that during the fasting time?
Yeah, I can't say for certain, but from personal experience, and I think maybe I did hear this, but as long as there's nothing else in it, like if it's black coffee or just pure tea, yeah. But as soon as you add like cream or sugar, that's going to take you out of that keto state or that fasting state. So, yeah.
Are the chefs at the facility, are they customizing meals for refeeding, or is it like a cafeteria and everyone gets the same?
Yeah, that's great. I guess I skipped that on the slides. So there's a refeeding schedule that we'll give to the patients, and then it depends if they're like autoimmune or they have high digestive sensitivity, like an SIBO kind of picture. But most of the time, patients know what they're supposed to eat based off of their schedule that is somewhat individualized. And then it's an open bar, salad bar, and there's cooked foods and all that. So general rule is half of the time that you water fast, you want to spend refeeding. So somebody that does a 20-day water fast would want to spend 10 days of just refeeding. And so that goes, and then within that, there's a kind of 5 stages of refeeding. There's juicing, then just raw foods, then cooked vegetables, cooked grains, and then legumes. And so anything that you've already like introduced into your diet, you're still able to eat on those days. So like on the grain day, you're still able to eat salads and all that kind of stuff, but you can't jump ahead too quickly. And that's just basically the order that it takes. The more live foods and raw foods pass through your digestive system a lot faster. So that's their method to not go into refeeding syndrome, and also to start the digestive tract back up. Because with a 30-day fast, they're not going to be having bowel movements after about day 4. So you can't just overload the system. So no, to answer your question, the chefs don't specifically make meals, but we will say like someone with high sensitivity, they can't have anything but zucchini for 2 days instead of juices, like for autoimmune. So then yeah, we would bring them steamed zucchini or blended zucchini, so they do customize it when necessary.